All right, everyone. Why don't we go ahead and get started? Good afternoon. Welcome to Grand Rounds 2013. So this is our first session back. Really excited today. We have a fabulous panel here to talk about the environment of health, not only in our community, but our nation as well. We've been talking about different things this semester, last semester about cases in Nashville, and we have several people that are dedicating their careers and their passion and their profession to making sure we all live healthy, active lives here in our communities. So just to give you some rundown, there is an attendance sheet floating around if you don't mind signing that for us. Sorry about the heat. We've actually been working on that for the last couple of hours. Apparently the heat was turned off in because it's winter time, so we're enjoying the lovely weather today. So bear with us as far as the temperature goes here. I think we're going to burn a few calories. So we have a great afternoon planned for you. What we're going to do this afternoon is spend a few minutes looking at a video that kind of refreshes your idea about different topics that we've been discussing. We asked you to review the bonus short on the Way to the Nation, Nashville Takes Action, that talks a little bit about some of the programs here in Nashville. And so this video will kind of bring all of that together. It's actually from the CDC, and it was released in 2011. So it'll talk about some of the issues that we've been discussing already and sort of refresh you on that. And then we'll have our panelists come up and we'll have them introduce themselves. I'll go through the panel group here and have individual questions for them all. And then we'll take a short break. We'll come back and we'll have a general session. We'll have lots of questions for the entire panel. Obviously, a lot of these topics overlap and intertwine, so there may be lots of discussion from everyone on the panel, and it's really up to all of us how we want to sort of lead this group this afternoon. I've asked the students to have some questions as well, so we have a mic here, so we can have someone come over. If you have a question, just raise your hand. We'll be glad to entertain that for you, and we're glad you're here this afternoon. All right, let's go ahead and get started.
Obesity costs this country about $150 billion a year, or almost 10% of the national medical budget. Approximately 1 in 3 adults and 1 in 6 children are obese. Obesity is epidemic in the United States and a major cause of death attributable to heart disease, cancer, and diabetes.
CDC TV presents Health Matters.
At its simplest, obesity results from people consuming more calories than their bodies burn. But it's a more complex problem than that. People didn't decide to become overweight. Their weight gain is a consequence of complicated changes in the environment, where food is more readily available and opportunities for physical activity are lacking.
Societal, economic, cultural conditions have all contributed to the rise in obesity.
One contributing factor is the fact that the way we eat has changed over the last 50 years. Americans are eating more processed foods and eating out a lot more frequently. The foods that are offered in restaurants, snack shops, and in vending machines are higher in sugar, calories, and fat than what we typically prepare in our own homes. We are surrounded by food. We're constantly bombarded by it. We're consuming larger portion sizes and more calories than ever before. Another factor is that people who live in poor and rural communities may have less access to quality grocery stores that sell healthy and affordable options. In these areas, it might be easier and cheaper for residents to purchase less healthy foods and beverages.
Other factors such as technology and the way we build our communities has influenced our lives. Both of these factors have left us more sedentary. Families must drive to work and school because it's often too far to walk. Many communities are built in ways that simply make it difficult or unsafe to be physically active. For many families, safe routes for walking and biking to school or play may not even exist. Getting to parks and recreation centers may be difficult, and public transportation may not even be available. And we spend a lot of time sitting in front of screens for work and for entertainment. Also, too few students get daily quality physical education in schools.
There is no single or simple solution to the obesity epidemic. It's going to take solutions at many levels in order to resolve the epidemic. What can each of us do as individuals to be healthier? First, we can eat more fruits and vegetables and fewer foods that are higher in fat and sugar. We can also drink more water instead of sugar drinks. Everyone, including adults of all ages and ability levels and children, need to get the recommended amount of physical activity. Parents can listen to their pediatricians and restrict television viewing for their young children to less than 2 hours a day, and we cannot put televisions in our children's bedrooms. How can we work together as communities to resolve the obesity epidemic? Communities can expand access to fruits and vegetables through farmers markets programs like this one in Brownsville, Texas.
The market was designed for the sole intent of reducing obesity rates and improving diabetes rates in our community.
There's a wide range of people who come to the market from different walks of life.
Low-income families who may not be able to afford some of the fruits and vegetables. The voucher program has been very instrumental.
Communities can also advocate for quality nutrition programs and physical education in their school systems. One way to do that is through school health advisory councils.
The School Health Advisory Council is something that doesn't cost any money, and it is relatively little amount of time, and it brings together a diverse group of people from the community and the schools.
I like to be healthy because I want to be big and strong.
Because schools face so much pressure to try to do so many other things, the School Health Advisory Council is the perfect way for schools to achieve it.
Local governments and communities can play an important role in developing environments that encourage and support active living. They can increase opportunities for physical activity by encouraging mixed-use development to allow for easy access to schools, businesses, parks, and grocery stores. They can implement traffic safety measures and crime prevention strategies. Building bike paths, sidewalks, and crosswalks will foster safe and easy access to more physical activity. States and local governments can provide incentives to existing markets to offer healthier food, and they can also provide incentives for new businesses to establish their supermarkets in low-income areas.
The quality of the produce is much better, and of course it's least expensive than at the corner stores, and this is very helpful to the neighborhood, I think, to overall be a more healthier neighborhood.
I had lived in Philadelphia all my life, and I had never was a market like this around here that we can walk to. That's a convenience, and on top of that, healthy foods.
Employers can offer worksite health programs that offer a variety of options for their employees, such as this program in Austin, Texas.
This used to just be a place to come to work and go home, and now it's a place where you can come and get in your workout and get in your support group for your weight loss. And instead of just going to the short order cook and having a burger and fries, you can have a nice, healthier sandwich. And that's made a difference.
In addition, employers can make it easier for women to continue breastfeeding when they return to work, because babies who are breastfed are less likely to become overweight later in life.
There is no simple solution to the obesity epidemic. People need to make better choices, but we also have to change those choices in our schools, in our child care settings, in our work sites, and in our communities.
Thank you. I'd like to invite our panelists up to the table, please. Let me go ahead and introduce them while they collect their things. I have Ms. Kelly Francis Fenlon, the Executive Director of the Nashville Mobile Market. I have Dr. Terry Jerkins, MD. She is located at Midstate Endocrinology Associates. Also have Ms. Jennifer Bailey, who's the SNAP Outreach Specialist at Community Food Advocates. And Dr. William Stephen Paul, the Director of Health of Metro Nashville Public Health Department. Ms. Joan Randall, who is at the Vanderbilt Institute for Obesity and Metabolism Diabetes Center, the Executive Director of the Tennessee Obesity Task Force, and Ms. Casey Reese, who is the Regional VP of Sales for Health2U, a subsidiary of HCA. Please welcome our guests today. I would definitely like to thank you for your time. I know you're extremely busy, and we had a sort of a short request here for them to be here today, so many of them rearranged their schedules, so I'm very grateful that you would be here to talk about these important subjects today. Dr. Paul, would you like to start? Give us a little brief background bio, and then some of the work that you're in, projects that you're involved with right now.
Sure. Good afternoon, everybody. I'm Dr. Bill Paul. I'm director of the Metro Public Health Department for Nashville and Davidson County. So I am in charge of the public health, governmental public health department for this county. I'm a physician. I have training in internal medicine and infectious disease, but my career has been really in public health. And for some people, it's like, well, what is public health? People have a vision that public health is medical care for poor people. Really, public health is what we do as communities to be healthier and be protected from disease. So I'm a physician. My patient is the community and the communities of Nashville, and my prescriptions are all aimed at going upstream and preventing illness, intervening in epidemics. One of the big epidemics of our time is this issue of, well, we call it overweight and obesity, but we're really focused on epidemic of not getting enough physical activity and not eating right. It's not so much how people look. It's really those behaviors that are the source of our chronic disease epidemic. And we've had some great opportunities, and we've worked with many of the folks and partners at the table here in the last couple of years to start to make some change in Nashville along the lines of what you saw in the video. And I'm happy to talk more about it. I'm not going to say any more because you got to get through the whole panel.
That sounds wonderful. Thank you.
Hello, everyone. How you guys doing? Stretch it out a little bit. I know it's hot in here. You probably just ate lunch. My name is Jennifer Bailey. I'm here with an organization called Community Food Advocates. Our mission is to end hunger and create a healthy, just, and sustainable food system here in Middle Tennessee. In my capacity, I serve as the SNAP, or Food Stamp Outreach Specialist, coordinating efforts to get low-income individuals eligible for the food stamp program enrolled in the program. Currently, we run 3 different programs. My program, which is Food Stamp Outreach and Advocacy, the SNAP Fresh program, which is a program that looks to connect low-income individuals with farmers markets, so one of the solutions that you saw in the video. And we run a program called Growing Healthy Kids, which tries to improve the quality of nutrition in our Metro Nashville public schools. In my previous life, I was a Bill Emerson National Hunger Fellow. How many people are nutrition folks here? Awesome. How many people, are you guys seniors, undergrads, graduate students? Graduate students, yeah. So I encourage you, if you're interested at all in public health or hunger as an issue, the Bill Emerson National Hunger Fellowship is a great opportunity to get on the ground and do real community work around these issues. I was at Community Food Advocates for my field placement for the program, and I worked on a campaign called Restoring Nashville, which looked to connect faith communities in food desert communities to try to improve access to affordable, healthy, and culturally appropriate foods there. So I'm happy to answer questions about a range of food-related issues, and just really glad to be with you all today.
Good afternoon. My name is Casey Reese, and I'm with Health2U, which is a subsidiary of HCA. My focus is really where all of you hopefully are going to want to spend most of your time when you graduate. So my focus is, does anybody know where we spend after you graduate most of your time? At your where? At your job, right? Everybody wants to have jobs when we graduate. So my focus is to work with employers for health and wellness programs. We set up on-site clinics. We do face-to-face coaching. I know they talked a little bit in the video. My past life, I was actually an employer myself. I did performing arts, so I worked with a lot of children who are suffering from obesity. So with the healthcare reform and everything that is coming up with more employers focusing on a healthier workforce and reduce healthcare costs, that's my focus. So I'm very excited to be here.
Hi, I'm Joan Randall. I am with the Vanderbilt Institute for Obesity and Metabolism. I entered the public health realm sort of as a second career as I saw what was going on with my kids and as they were growing up, and soda became an abundant need for all of the kids and all of their friends. And I just saw what was going on nationally and was then focused my MPH on childhood obesity, and was fortunate enough to work with the Surgeon General's office to help develop a national plan around obesity. This was in the early 2000s when obesity was kind of just rearing its head. And then as the South became worse and worse, as you look across the U.S., Vanderbilt recruited me to try and figure out how Vanderbilt could be impactful from a public health outreach perspective. So I became very involved with the Tennessee Obesity Task Force, which now has over 700 statewide partners, which I'll probably talk about a little bit more later. But we have developed, in 2010, we launched a comprehensive plan to address nutrition, physical activity, and obesity across the state in all sectors. And we are now trying to implement that plan, working with all of these partners and partners in every jurisdiction across Tennessee. And in all professions, hopefully we can engage a lot of you in what we're doing going forward.
My name is Terry Jerkins. I'm an endocrinologist here in Nashville. I see what happens to people if we aren't able to intervene early on. So back in the 1990s, Dr. Ed Caporelli and I put a bill through the Tennessee Medical Association and got it passed, asking for removal of the vending machines from schools, the resumption of mandatory physical education, and the change in the school dietary plans to educate better about good intake. Unfortunately, we're only able to work with the vending machines at that time, but seeing all of this now happening where people are really recognizing what the impact is going to be when young people have type 2 diabetes, it's very gratifying.
I'm Kelly Francis Finland, and I am the director of the Nashville Mobile Market. We are very much what we sound like. We have a 28-foot trailer that's been re-outfitted as if it's a grocery store aisle or a farmer's market, and it's stocked with fresh fruits and vegetables, some select healthy dry goods, lean deli meats, lean dairy, eggs, and I believe that's all, and some juices as well. And we go into food insecure areas in Nashville and sell produce, sell everything from the market. The market actually came about, it was the idea of a medical school student at Vanderbilt, and because of that, retains both an edge of a learning lab, so it's a space where students from mostly Vanderbilt, but we also actually have one Lipscomb student and one Belmont student who also work with us, who come on and work as the staff of the market and get into communities, get to talk to people, get to learn about people's lives, and the fact that they encounter physical barriers to healthy food access, financial barriers, and educational barriers. And so that's anything from not having enough money to put good food on your table, not having access to a store, not being in a neighborhood that has a good grocery store in it, but instead only has convenience stores or fast food restaurants, maybe working 2 jobs, not having time to cook, maybe having grown up in a household that didn't cook, and so that's not something that you're habituated to and know how to do yourself and see as a priority. And so that way, we work to bridge both the community and the academy and what's happening there, and also to start to rectify some of the market failures that exist specifically in Nashville when it comes to healthy, affordable food access.
Great, thank you so much. Dr. Paul, I'd like to address the first question to you. Tell us more about the U.S. Health and Human Services Stimulus Fund recently awarded to the city of Nashville. I understand we're the only city in the state of Tennessee as well.
Yes, Nashville was fortunate to get a Communities Putting Prevention to Work grant. This is through the Centers for Disease Control, and you remember with the economic crisis, there was a stimulus that was aimed at really providing jobs, but also providing a lot of various other things that communities want. Anyway, it became an opportunity for CDC to kind of, in a more serious way than it's been done ever, to really look at community transformation effort as something, as a tool against the chronic disease epidemic, and ideally to get some evaluation done so that we know the impact of these kind of interventions on people's behavior and in the long run on people's morbidity and mortality. So we had this opportunity over the last 2 years. It was extended until December, and now it's done. So we had this infusion of support and 24 different projects, all really aimed not so much at individual behaviors or programs, the way we often think about programs where people sign up and try and change their individual behavior, but changing the environment, the kinds of things you saw in this video and probably in Weight of the Nation. We tend to just sort of gloss it over and call it policy system and environmental change, but it's really trying to change the context, change the default, so that the healthy choice is the easy choice. We talk about teaching our kids how to make healthy choices, but then we put unhealthy choices. We don't bother to put the healthy choices in front of them or give them the opportunity to be physically active on the way to school, at school, and a variety of other things. So I can list through a few of those projects, or we can talk about them over time, but it's everything from really helping Nashville in its efforts to make the built environment healthier, complete streets policy, some urban planning type work, working with the schools, and they've taken some steps towards making their offerings in the cafeteria healthier, and that's a process that's ongoing. Vending machines in high schools. There is now a policy at Metro Public Schools. So, thank you. We got rid of vending machines in elementary and middle schools.
They wouldn't take them out of high schools because they contribute to the extracurricular activities.
That's right. It's a cash flow issue. So the coaches get cash, or the principal gets cash, and it's like they don't really get discretionary funds. So they'll help with uniforms or with helping kids who can't afford to go on field trips or what have you. Well, part of what we put together in all these projects was really to try and create a movement. We call it, we put a label on what we did along with a lot of other people in Nashville as Nash Vitality. But as part of this CPPW effort, the schools have implemented a new policy on vending machines in high schools, and they're going to centralize control of high schools. And by August of 2014, all of the choices in high school vending machines will be healthy choices. So there's that kind of progress. Mm-hmm. I could go on. There's gardening stuff. There's bicycling stuff. There's the new B-cycle bikes. Those were something that Nashville invested in with this community's putting prevention to work. But I could go on. It's exciting times. We've gotten a lot of things done, and we're starting on an evaluation process. But across the country, that's kind of a big lab. You compare what for us was an enormous amount of money, $7.5 million in 2 years. That's 2 hours of revenue for the hospital where Joan works. It's 2 days of revenue for the hospital. It's 2 hours of revenue for the healthcare industry in Nashville. So there is, it's not that much of an investment. And if communities decide they want to change things, I think we can.
So how did you begin with this stimulus fund? Where did you know where to start? How can each community, we talk about eating local. Is this one of those, it needs to be local, and how do you sort of prioritize things? This one-size-fit-all type idea? It really did. There's a lot of ideas out there, and there are places where, like you saw some grocery store type issue highlighted in Philadelphia. Well, Philadelphia's been kind of like the ones we all kind of want to copy for food issues. So some of it was looking at best practices, but really when we wrote the grant, we sat with community partners and said, well, what are the priorities? What are the things we can accomplish? And so there was a community action plan developed along with a variety of representatives from the community. It was in a hurry, and it needed to change over time as the projects were implemented. But I think that's another thing about public health is it really is, it's really got to be owned by the people who live there. You can't, the doctor doesn't come in and just write a prescription for Nashville. You've really got to listen to what people are ready, what kinds of change people are interested in, and what kinds of change people are ready to make. So the partnerships are the key, is what I've heard you saying, absolutely. Yes, listening, community planning, and partnerships. Okay. So what do you think, this whole program has actually changed the culture of Nashville. I mean, we saw in the videos a lot of people coming out doing things that maybe they've never done before. How do you see that changing our city?
I think there's been change. I mean, I really think there is change, and it's hard to put a finger on, well, we did these projects, so there's change. You know, Community Food Advocates has done things that have changed the conversation in Nashville. The Tennessee Obesity Task Force has done things that have changed the conversation in Nashville, and Dr. Jenkins, and the mobile market was, you know, happened at about the same time. So I think there's a lot of people and a lot of interest in moving things. I'm a little bit afield of your question.
I just didn't know if you felt like there was a literally culture shift in the city of Nashville, or if the timing sometimes is critical.
Around the other thing that kind of helped us is that Mayor Dean is really interested in seeing Nashville become healthier, and it's kind of a competitive issue for cities. As the population, you know, if a company wants to relocate to the Southeast, and Southeast has this reputation of being all unhealthy weight and not physically active, the healthcare cost for the employer is going to be an issue.
Right.
But Mayor Dean's just really been passionate, and he's had his Walk 100 Miles campaign, and he's had his 5K campaign, and he's been out in front on a lot of that. And I think that's helped with the visible sense of change in Nashville.
Yeah.
And I think more people are biking. There's more facilities for biking. I think that there is change afoot. It's slow, but you know, it seems like Nashville's a little different than it was 5 years ago.
It does seem that way, and it's almost like a ripple effect. You know, you start to notice more things, and we do thank the mayor for all his work, and obviously all your work as well, and the combinations and those partnerships are really what's going to propel us forward. You were actually part of the Way to the Nation series. What was the filming like, if you won't mind just telling us a little bit about that?
Oh gosh.
I didn't know how long the crew was with you, or if that's something you've experienced. Not many of us have been on an HBO documentary, so I thought you could enlighten us a little bit.
They were here a couple of days. The thing that was pretty amazing about this was the mayor had been doing his 100-mile walks, and the crew had decided to film the walk at Hadley Park. And this is kind of a gamble. I mean, the mayor has put tons and tons of his time into these walks, and sometimes a dozen people would show up, and sometimes 100 people would show up. And it kind of did snowball a little bit. But for that particular walk at Hadley Park, it was a huge crowd.
Okay.
It was a diverse crowd. It was beautiful lighting and a beautiful day and a beautiful park. And so, you know, it felt like, well, Nashville's going to look really good, and Mayor Dean's going to look really good. And I've heard, you know, around the country, other public health folks saying, boy, we wish he had a mayor like Carl Dean.
Okay.
So some of it was luck. I think part of what enabled that to happen, the Way to the Nation series was connected. I'm going to have to stop talking because there's other people here.
Actually, you're fine.
I'm good. Okay.
Yes.
It was connected to an Institute of Medicine report on accelerating progress for prevention of childhood obesity. Former Mayor Bill Purcell was on a panel related to that. Carl Dean got connected to that. But also, because Nashville had CPPW, we were a southern city, if you see the maps, the Southeast looks bad for a lot of stuff, especially obesity, diabetes, and that. So just the idea of a city in the Southeast that's really making some change was something that was probably good. It fit with what the Way to the Nation was trying to do.
Great, thank you so much. Ms. Bailey, I'd like to ask you a few questions. With Community Food Advocates, can you describe how food influences individuals and shapes society?
Yeah, I mean, if we think about those moments in our lives that are most memorable, moments with our families, moments with our friends, often they involve food in some way, shape, and form, right? Food becomes a part not only of ourselves and who we are, but part of the way we relate and interact with one another. So when folks don't have access to the type of food they need to thrive, it becomes almost a human rights issue, right? If you're not able to consume the types of food that it takes to live a healthy lifestyle or culturally appropriate food, so food that you're familiar with, it can become a real detriment. So at Community Food Advocates, one of the things that we're very passionate about is bringing food back to the forefront. And not just any type of food, right? But food that is good for the body and also good for the soul.
And I really like your motto, everyone eats, so that includes
Yeah,
all of us, doesn't
everybody
it?
eats.
That's right. Can you also explain, especially to the students here, what the term food security means and why that is so important for our communities?
Yeah, absolutely. So food security is a term that has become popular over the past decade or so. That originated with the United States Department of Agriculture, actually, as a substitute almost for the word hunger, because hunger as a phenomenon, as we might know, isn't exactly measurable, right? You might feel hungry, but there's no way to really have a metric around measuring exactly how hungry you feel. So the USDA started using this term food security or food insecurity as a means of measuring how much folks were intaking in terms of fresh fruits and vegetables, lean meat, dairy, things like that. Nationwide, the community food security movement has really taken off. It's a lot of folks who are interested, I like to say, the food system from farm to fork, right? So from the way we grow our food, special emphasis on local agriculture and urban areas, urban agriculture, all the way to the fork, so the food that's accessible to us as well.
Great, thank you for that. Can you explain the food deserts here in Nashville, just to remind us how many we have and where they're located?
Yeah, so I can talk a little bit about food deserts from my own personal experience. Is everyone familiar with the term food desert? Have you heard of it? Yeah. So food deserts, for those of you who might not be familiar with it, are areas that have little or no access to affordable, healthy, culturally appropriate food. So that's things like fresh fruits and vegetables, lean meats, dairy. Here in Nashville, through our work at Community Food Advocates, we identified 3 food desert communities: North Nashville, all of North Nashville, Edge Hill, and East Nashville near Casey Place, which is the largest public housing development here in Nashville.
Thank you. And I know faith is very important to you, so would you talk a little bit about your food and faith connection?
Yeah, absolutely. So in my other life, I am seeking ordination in the African Methodist Episcopal Church. I'm a full-time graduate student at Vanderbilt Divinity School. So to me, when I say that food and food access is a human rights issue, it's also an issue of human dignity for me as a Christian and as someone seeking ministry in urban areas. I'm from the south side of Chicago, which is also a massive food desert. I've seen the way in which folks' human agency isn't really engaged or seen as valuable because they're not able to get the nutrition that they need. And very practically, the role of food in faith communities is so big. I can't count the number of church potlucks I've been to, or even the act of the Eucharist or the Holy Communion. Food is very central to the way that I live my faith as a Christian, but also the notion of fasting in Islam and Judaism, being kosher, right? It's very instrumental to what it means to live a healthy life as a person of faith. So
Thank
I could
you.
talk for days about it. Come see me after.
We have such great panelists. We could spend 2 hours with each one. I definitely agree with that. So thank you for sharing that with me. Ms. Reese, I have a question for you, if that's all right. Why is wellness becoming such an important issue for employers and executives?
It's been a great transformation over the past 5 or 10 years to see employers finally focus on what they can do to make their employees and workforce more healthy. I think back to what Dr. Paul just said about what parents say to their children, and the thing that just popped in my mind is what employers tell their employees all day long is, we want you to make healthy choices, but they don't give them options to make healthy choices. So just access to healthier foods in a cafeteria, or their sedentary lifestyle if you work at an office desk, to not giving them time to go off to the doctor. So we're seeing huge strides in employers, giving them incentives to do so. So we're seeing a lot of employers give actual money back to their employees for doing healthy choices, from losing weight to just going to get their lab values to see to know their numbers, to everything from doing healthy challenges. I've seen so many employers here in Nashville actually give their employees time off to go walk a mile every day, to looking at different workstations. Has anybody seen the treadmill
desk?
Those are really taking off, and how fantastic for some people to actually get to to have movement in an 8-hour day. So those strides, and seeing employers not only saying that we want you to do that, but giving them access and opportunity to take advantage while you're at work. You're away from your home. A lot of people in Nashville do commute. So there's that 45-minute window where they're in a car, sometimes one way. And so, they work there with their families. So if they come home, the last thing some people want to do is go to a gym. So that's been an excellent thing for me to see.
Okay. So how do you think the health of their employees impacts their bottom line? What's their incentive to make sure they have a productive workforce?
Productivity is it's extremely important for two reasons. One is if you miss work, let's think about a school system. What happens if a school teacher misses work? The school system has to hire temporary workers. You guys think about the healthcare industry. If a nurse that's a specialized position is sick and takes off work, some employers struggle to find the replacement. So then, are they productive? Are they getting their, are they meeting their job requirements? So there's that additional cost that's in there for temporary staffing. To think of a trucking industry. If a truck driver has a catastrophic claim, goods are left sitting here in Nashville instead of going out to Chicago, and that impacts all the other employers that they service. So productivity is huge in employers, not only for their own bottom line and healthcare costs, but how they run their business.
That definitely makes sense. So how do you have so many services at your company, how do you really tailor your services and help employers know what's best for them, to know how to use your services in a way that's really tailored to their needs for their own company?
I think one of the exciting pieces of my job is to take an employer and look at where they are in building a culture of health. I like to go in and ask them, where are you in building a culture of health? Are you sitting on the couch right now, or are you couch to 5K? Have you started getting your employees, off the couch into incentives, or have you already done a 10K? You'll see so many different varieties of employers in different aspects of their culture of health. One thing that you guys all know, dealing with patients, you have to meet that person where they are. And the same thing happens in an employer. It's that readiness to change. And then you've also got to have leadership. They've got to be able to be actively involved. Our mayor here is very active and engaged in being healthy. You've got to make sure, sometimes that's a challenge, where they do want to reduce healthcare costs, but their leadership in the company doesn't want to walk the talk and be engaged and involved. So sometimes it takes a little bit longer to get your initiative where they want to be.
That sounds good. Thank you so much. Ms. Randall, I just wanted to ask you a few questions, if that's all right. Tell us more about the goals, the program, and the overall membership of the Tennessee Obesity Task Force.
The Tennessee Obesity Task Force kind of loosely became an entity in about 2007. The Southern Obesity Summit was held to try and figure out a Southern strategy. It's like, why is the South doing so poorly? So at that time, there were some smatterings of folks that came together from Tennessee and started talking to each other, but they weren't necessarily working together. So they kept talking, and then in 2008 were successful in getting funding from the CDC. The CDC funds about 25 states right now to do a comprehensive obesity program. And so Tennessee was successful in getting 5 years worth of funding, and it was to bring stakeholders together from across the state. So what we did was really look at, the social ecological model. What are the influencers of obesity? What's going on in the home? What's going on at school? What's going on in early child care? What's going on in work sites, as she described? All over, our choices, our environments, were being impacted by a number of different environments. So we looked at who are the experts in the built environment and in the academic setting, in the provider settings, and came together with a number of champions across the state that developed this comprehensive plan. And so, not wanting this plan to be sitting on a shelf somewhere, and also mandated by the CDC, we needed to get this plan moving. And so we have 11 action teams, which are really on the ground working in breastfeeding and built environment and parks and recreation and early child care and work sites, all of these areas, food policy across the state, very connected. So Memphis is talking to Nashville, talking to Chattanooga, talking to Northeast Tennessee. What's working, what's not working, how we can help you, how we can really continue to move forward. The wonderful things that are going on here in Nashville. Dr. Paul was amazing in starting the efforts around menu labeling, for example. Well, how can we take menu labeling? We did pass it here in Nashville. We managed to crush it at the state level. But it started the conversation, and it really brought together a lot of strong organizations like the YMCA, for example, had never done policy work before, came on board because they want to have a new health outreach focus, and brought together people around coordinated school health. So we've been doing a lot of policy work. Our focus is on more population-based strategies so that it's not just a program that's going to go away. It's a policy that will hopefully impact the whole state. As she mentioned, they did vending. We're now working on vending in high schools. Hopefully we can get something moving in that regard. We did pass a breastfeeding law. So we're looking at more sort of big policy across the state and also supporting federal policies and really keeping people connected and moving forward in line with the national strategies that Dr. Paul mentioned in the IOM document.
Great, thank you. So at Vanderbilt Medical Center, how does food play a role in the concept of creating a healing environment for both your patients and also the employees? I know that's a big question, but I know you have lots of programs going on, so would you just like to briefly discuss that as well?
You know, it's interesting because we have an article in JAMA that came out today on the food environment at Vanderbilt. The med students came to me 3 or 4 years ago and said, well, you know, really, McDonald's in the middle of our campus, that's not right. And so they approached administration, and we really built up this amazing energy around this McDonald's issue at Vanderbilt. And a number of other academic institutions are sort of going through that process right now. But God bless our med students. They took this all the way to the top. We worked together. They brought in new vendors. The lease with McDonald's was almost up, so they had a window of opportunity where they could address possibly engaging another vendor. And we went through a number of different, I think we had 9 who responded to our RFP and went through the whole process. And the most opposition we received at Vanderbilt as far as getting rid of McDonald's was from our medical staff and our nursing staff, because it's comfort food for patients and it's comfort food for them and a lot of our environmental workers, those who don't earn as much money. So, but we were successful in getting rid of McDonald's, and they held a wake on campus to mourn the loss of McDonald's. But what it did was create a food advisory committee, which I am now part of, and we have a step-by-step. You can't do a whole lot really, really fast. You have to do very incremental, and I'm sure you knew this with Worksite Wellness, very incremental changes with employees. You know, we've got now healthy vending. We're changing the mix gradually over time from 30% to 50%. Gradually, it'll all be healthy food in the vending. We've got incentives in the cafeterias where the healthier food is less expensive. They get a free water with their meals rather than buying a soda. So we're trying to be very creative and engage the community in some of the changes that we're making.
That's wonderful. We'll check out that article as well, so I'm looking forward to that. Dr. Jerkins, have a couple of questions for you. What are the daily struggles and environmental barriers your patients face when trying to manage their health-related issues? I don't know if you want to step back and sort of describe your typical patient and then sort of lead into that question if that's more helpful.
Well, my typical patients have type 2 diabetes or metabolic syndrome, which is the physical findings and the biochemical findings, for example, elevated lipids of people that are going to have diabetes. And one of the biggest barriers is that people have no clue about calories or portion sizes. And one of the simple things I'd like to propose is that we make all of those word problems that we laugh at beginning in first grade relate to food and calories and how many calories are burned, so that people are subliminally beginning to recognize that there's an in and an out. As they got older, then they could even be figuring how many calories they burn and subtract that from the total. That'd be a lot more interesting than a lot of the math problems I used to work. because people don't get that. They don't understand when they look at calories to multiply the portion size. So when kids start to multiply, that if you like, Jenny likes 6 tablespoons of ranch dressing on her salad. Ranch dressing has 180 calories per tablespoon. How many calories does Jenny get from her ranch dressing? Billy gets 1,500 calories a day. He drank 4 cans of Coca-Cola. Each can of Coca-Cola has 180 calories, assuming you're getting a little one. How many calories does Billy have left for food? How many people in this room know how many calories they eat? Really? That's what we're dealing with. And you are educated people. And many of these children don't have parents that know how to count calories or know what a calorie means or know that you only have to be 200 over your limit per week to gain a pound. So that would be one simple way to start making people recognize what they have to do, because you got to get the math problems from somewhere.
That sounds like a wonderful idea. We can put some of those on our test questions, can't
Then
we?
because most of these, lots of these family members don't cook. When I was in high school, people had home ec. Why could they not have a portion of health devoted to 4 weeks of how do you cook a healthy meal? What is a healthy meal and how do you cook it? And as part of their test, they can go home and cook it for their family.
Is that another barrier that you see, that most of us, you know, we're living such fast-paced lives that we're not home cooking, or we don't have parents that cook, and now we're really losing those skills because
completely
we don't really know what to do, or it's overwhelming, or how to plan
The
and
ones
how to
that
think
cook
about
are the
portion
grandparents.
sizes.
It's not the parents. And we have access for them to be able to get healthy foods, so we could even get them aware of the fact they can go get these things, bring them home, and this is how you fix them.
So is it almost overwhelming for some of your new patients
It's totally
to be thinking
overwhelming.
about all these things, not just their disease, but really all the things that they have to do? And how does family also become a barrier sometimes as far as promoting or...
We'll have people that are 1,000 pounds and be discharged from the hospital, and their family will still feed them, because if you love somebody in the South, you're going to feed them.
Food is love, that's right.
And we're not going to stop that. What we need to do is, if you love somebody in the South, we're going to feed them healthy stuff. We're not going to bring them something just because they want it. We're going to talk about why it would be better to have this. But this has to be started young. Children's tastes are formed by the time they're 10 years old. I have parents bring in 300-pound teenagers, and we start talking about what they need to eat, and they don't like anything except a McDonald's hamburger. They're picky. They won't eat anything. And I'm like, yippee, here's a protein shake. You get 3 a day. Hold your nose. That's not an option lifelong. That is not an option lifelong. So these people have got to develop taste for these foods, and they're not going to get it at home. You know, if we worked from the standpoint of doing that in math class as they got older, they could be adding up how many calories they eat. Come back from lunch. How many calories did you eat? How long do you have to exercise to burn that? Which exercises? Pick it up. How many hours will Jenny have to walk to burn her 2 cans of Coca-Cola? How many laps of the gym will Jack have to run to burn his Pizza Hut pizza?
Yeah, most of us are not aware of exactly what we're
No,
taking in.
and that's why we need to start with that, because then you have parents that are helping kids with homework. Aha.
That's right.
All of a sudden they have access to it in something they can understand.
That's true.
Even if it's in English as a second language.
So as a physician, seeing all this every day, what is your biggest concern? I mean, we're talking about obesity today, but it's really about chronic disease, and really, you know, we want to even get past you know, we want to be the absence of disease. We want health and vitality and wellness. That's really our ultimate goal, but right now we're dealing with so many issues when we look at just the burden of chronic disease. So what is your main concern as a physician out there day to day?
Several things.
What's going to happen to our communities and our families?
Pima Indian children, and those are the Native Americans that live in the Southwest and New Mexico primarily. We know if they get type 2 diabetes before they're 18, a third of them will be dead by the time they're 30. People think, oh, well, I got diabetes, but I'm young. It's not going to hurt me. Type 2 diabetes does not care how old you are. You start to develop advanced vascular disease from the moment you get it. Now I'm seeing my patients in their 70s and 80s bury their children in their 50s. The patients my age, I'm in my 50s, will be burying their children in their 30s. We don't have the income in this country to support a whole generation of disabled people. And it's not just from a standpoint of the diabetes, it's heart disease, hypertension, sleep apnea, reflux esophagitis. Lots of people have hiatal hernias. Lose 30 pounds, it's going to go away. So these are all things that are contributing to why healthcare costs are rising, to why more people are on disability, why there's more absenteeism. And the most problematic thing of this is if you're overweight now at your age, it's not such a big deal to get it off, because you can still be very physically active. When somebody's 300 pounds, walking across the room's an effort. So it has to be almost solely caloric restriction at first. And that's why it's so difficult. So we've got to keep people from getting to that point. And when we have them coming into high school weighing 300 pounds, it's too late. So that's why it's so important to get with that. And I cannot tell you how many people, and Vanderbilt's seeing the same thing, that we're seeing in the endocrine clinic who are teenagers with type 2 diabetes. We don't even have the drugs for type 2 tested to give in people under the age of 18. So, I mean, it's a huge vacuum, and it's getting worse and worse and worse. And that's why I think we need to address it at the bottom level. Because, yes, this will help some of the families that are motivated, but a lot of them are not that motivated. And we've got to have some way to get our foot in the door.
Thank you. Appreciate your perspective. Ms. Fenlon, I want to ask you a couple of questions. Your program, the Nashville Mobile Market, it's a wonderful example of really seeing a need and making it happen. Tell us how that dream became reality and what your goals are for the future as well.
Sure. I actually had nothing to do with making the mobile market a reality. I didn't hear about it until it had already been around for about a year, or a little over a year. It all started with a medical school student I mentioned, Ravi Patel, who in his first year at Vanderbilt was volunteering at the Shade Tree Clinic, the free clinic that Vanderbilt Medical School students volunteer in that serves an underserved population. And he kept having patients come in with obesity and diet-related chronic illnesses. And part of the conversation he would have with them, which is a conversation I'm sure you have had with patients as well, is about their nutrition, about how much they ate each day, about what they were eating, about how often they were preparing fresh foods and eating fresh foods rather than going to the convenience store and buying a frozen pizza or going to McDonald's and driving through and having a hamburger. And over again, he heard from these patients that they wanted to cook. They would love to be able to have more fresh fruits and vegetables in their diet. Lean meats sounded great, but they had no way to get to a grocery store. They had no access to fresh food. And maybe even if they did, they weren't really sure how to cook it or how to prepare it. And any access they did have would involve something like a 3-hour bus trip, or having to find someone to watch the kids and having to find someone's car that they could borrow so that they could drive to the store because they didn't own a car, or having to use their lunch break at their first job because they were working 2 shifts and didn't have time between them to get to the store. And so Ravi started to try to think of a way to start to bridge these market failures as he saw them in Nashville. And he initially went to the Organized Neighbors of Edge Hill, which is a wonderful community organization that's in the Edge Hill community, which, as Jennifer mentioned, is one of the primary food desert areas in Nashville, and started to talk to them and talk to a lot of the members of the Edge Hill community about what they thought would be a solution for this, or at least a way to start to alleviate the problem. And a lot of them recalled the market man, a man who had driven around in a pickup truck with lots of fresh fruits and vegetables in the back of the truck and just sold fruit and sold vegetables out of that pickup truck, and remembered him fondly. Everyone knew him as the market man. And so Ravi took this old idea and updated it and thought about the viability of putting that same sort of idea into a mobile market, a trailer. And so that's exactly what we have. He actually initially planned to come up with the idea and then pass it along to Organized Neighbors of Edge Hill. And if they wanted to do it, if they wanted to fundraise around it and try to gain traction with it, great. But it was the right idea at the right time, and the right people heard about it, asked him for more information, asked him to keep planning to continue to operationalize what this mobile market would look like, and he received funding. And so, with money in hand, went for it. And that's really why it involves students from the beginning. Right now, I'm one of 3 hired staff members at the National Mobile Market, and I'm the only full-time staff member. The other 2 are part-time who help drive the market and operate it in our different communities. Everyone else on staff, and we have a staff of around 20 folks, they're all students, most of whom are undergraduates. We also have some dietetic interns from Vanderbilt who will come on and do a rotation for a staff experience with us, providing samples and nutritional advice. We're about to start working with nursing students at Vanderbilt as well. I'm looking forward to seeing how that will unfold. But right now, we have students on the market and have always had them there, which kind of led us into being not just an organization that works to fulfill a need in the community, but also looks to fulfill a gap in the learning that takes place on a college campus by getting students into the community and having good conversations. So we went operational very quickly. We very quickly scaled up and became operational. I should mention, we're a social enterprise, so we sell food, but we're also a nonprofit. So we don't sell food for profit. Any profit that we make on the sale of the food goes right back into the organization to keep it running, so that eventually the idea is that we'll be sustainable and not reliant on grant money, and just continuing to operate on our own steam. That to say, we got operational pretty quickly and realized along the way that we kind of left the community behind in some of our locations. We had been invited by an organization in the community that was excited about us, but the community at the grassroots level hadn't heard anything about us. And let's be honest, they've been figuring out how to deal with their own lack of food access, lack of ability to cook for decades. And so we're a quick fix perhaps, but we're a fix that they may not know about, that may not be part of their habit, that may not be comfortable. And choosing the food that you eat, choosing the food that you put in front of your child, that's actually a very intimate decision. It's one of the few things, too, that underserved, lower-income populations get to make a decision about in their day-to-day lives. And so to start to try to change that decision-making process is really, and here I'll reveal my own divinity school roots, which I think is sort of funny. We're a ministry of presence in a lot of ways. We show up, and we've started now to do a lot better community outreach. So that speaks to what I hope for in the future. I hope that we can continue to gain relationships in communities with community members, as well as informal community leaders, not just those who are in charge of the organizations who know that this is a food insecure community and who want the community to change, but with the people in the community itself. The grandmother who has all of the kids over every Sunday and cooks them up a big meal because she knows that it might be the only meal that has any vegetables in it that they're going to get that week. We need to be talking to her. We need to be talking to her about how to maybe make greens without the ham hock next time and see how the flavor changes and see that maybe it doesn't change so much if you don't put quite as much salt in and what you could replace that with and how much healthier that is and what that means in terms of the long-term impact on the lives and health of those who are having that food. So to return back to the point, because I had my own tangent, I really am very hopeful that we will continue to grow our relationships in communities, because that's really the only way we will get people onto the market to actually buy the food that's there.
Continued relationships, I like that. Why don't we take a break for just about 10 minutes here, and we'll come back and have some general questions for the whole panel. Thank you. So we've already had one question turned in during the break, so I'd like to start with this first question for the panel and be thinking of any questions you may have coming up. So the first question to the panel is, what's brought you the most joy or satisfaction from your job? Sorry, let's go ahead and start with the first question from the audience today, and that's really what has brought you the most joy or satisfaction from your job? What's been your inspiration from your job and your programs that you've been working in?
For me, it's seeing people not die from diabetes. When I went into practice, I had very few patients that had had type 2 diabetes more than 20 years. In fact, the joke in my practice is I would much rather be a type 1 diabetic. I would trade with anybody there because you don't have to worry about anything but your blood sugar. You don't have to worry about heart attacks, blood pressure, strokes, all of that stuff, sleep apnea, all of the other things we talked about. And I now have some patients who have had type 2 diabetes for more than 40 years and are still healthy. So it shows that by taking these preventative measures we take with type 2s that were just alien when I started practice. We didn't give cholesterol medicine until you had a total cholesterol of over 300 then. And that's just in the last 27 years. To see that that can make that kind of difference, what I want to see is to see us stop people at the point they have metabolic syndrome and not let them develop the disease. Make the lifestyle modification before they actually get there. And that makes me really happy. When I have a patient and the whole family goes on a diet, and everybody, it used to be they'd come in and say, I have to cook for everybody else. So we had to re-educate. If you've got diabetes, your children have a 50% chance of having diabetes, so you do need to cook for everybody else. Right. Everybody else needs to come on board with your diet, and if you need to bring your spouse in here and I'll beat the crap out of them, that's okay too. But you can actually see that start to work, where the whole family goes on a diet. And that's where you really feel like you're making a difference, not just for this generation, but for the next.
Absolutely, absolutely. What else? What motivates and inspires you every day?
Well, I'm a doctor too, and I like to see a cure, you know. But now my patient is all of Nashville, and so I'm not sure that we've seen the cure yet, but in public health, what really is gratifying is to see the curve turn. You know, that instead of an x-ray, we've got a chart showing obesity rates going up, diabetes rates going up. What's happening? We don't quite have confidence in it in Tennessee, or I'm very skeptical, but I believe in various cities around the country, and I believe that we're doing similar things here in Tennessee and Nashville, that the curve is starting to bend, that all of the work that so many people are doing is starting to have an impact. So the state ranking is improved, and that's good, but it's like, well, we got to see if we've really turned the corner. It's exactly like monitoring a patient. It's like, well, I don't know if the patient's turned the corner yet, but it's starting to look like it's stabilizing.
But it's a long-term commitment, isn't it? So a lot of the programs and things that you're doing, we may not see the full benefit for several years.
Yes, I was going to use a couple weeks ago, during the holidays, I was using the analogy of the movie It's a Wonderful Life. Who's seen It's a Wonderful Life? I mean, the story is George Bailey never sees the impact he has on the community, except in retrospect. And a lot of times in public health, you work your whole career and you don't really see change. I do think, like we said earlier, I think we're starting to see change in Nashville, and the gratifying thing is if people actually become healthier and we see a turning of the rates and a reduction in health care costs and those kind of things.
I would say the highlight of my job is building relationships with community members. Desmond Tutu has this idea called Ubuntu theology, which is the idea that we are people through other people. So it's only when we're in relationship with others that we come to fully know ourselves. And the others that I'm meeting, through my position especially, are folks who are incredibly food insecure. I can't tell you the number of calls I get on a regular basis of people who are hungry, right? They call me and they need food immediately. And these aren't your stereotypes of who's hungry, right? I think when we think about the face of hunger historically, a lot of, it's a poor African-American mother who's living in the projects. That's not the story anymore in 2013. It's our mothers, it's our grandmothers, it's our neighbor down the street. So one of the most powerful parts of our work, I think, at Community Food Advocates is that we're able to build direct relationships with people. We're able to engage them. We're able to have a long-term commitment, right? So the fact that I show up at Loaves and Fishes, which is a local soup kitchen, every Monday means that I will see Johnny, and Johnny will ask me these set of questions, but I know his name, and someone else might not. And I think there's something incredibly powerful and life-giving about that. So, yeah.
I think for me, the biggest reward is when I see an employer, finally the light bulb goes off, that they realize that an ounce of prevention weighs more than a pound of cure, and they can do something about that. Employers play a huge part in our community. Some of our employers have been there for many, many years, and they're going to impact so many different people. So when they realize that they can make a change and give access to care and help change a behavior that's going to give you one more day with your family, that's a huge, huge stride and accomplishment for us as a community.
I think that something that I deeply appreciate, it's something that I preach a lot actually to my staff of students, and maybe you're glad you're not part of them. It's that neither the market nor the community that's receiving the food, sort of our customer base, neither our customer base or the market as a learning lab for students would exist without the other. And it's when both sides of that equation recognize it. So it's when students start to really understand that it's not just someone choosing to take their kids to McDonald's, it's a confluence of lots of really difficult factors that they see in a specific person's life that completely shifts their understanding of healthy eating and who has access to it and why it's so difficult. When they take that and start to feel fortunate, to feel lucky, not to feel like they're serving the community, but that they are absolutely having this wonderful opportunity to be in the community, having conversations with people and learning a lot while doing it. That on the one hand, and then on the other hand, when we have a customer come in who we ring up her basket of produce and she gasps that it's only $5.20 instead of $10 as it would be at the Kroger where prices are hiked up down the street and the produce is not that great. So to me, it's always reminding ourselves that I like to think of us as representative of the fact that we really do have an abundance. You can sort of look at the world through a model of abundance or a model of scarcity. You can, try to make sure you grab from other people because if you don't have it, then no one else should either. Or you can see it as everyone could have enough, but you have to be willing to take part in that solution and share. And to me, once we start seeing the market as an opportunity for abundance, an opportunity for abundant learning, an opportunity for an abundance of good, affordable, healthy food, that's what's very rewarding for me.
I'm in a position where, with the Obesity Task Force, I can see the bright spots across the state. And I've been here now for just about 5 years. And I know Dr. Paul isn't willing to celebrate our numbers dropping quite yet. I'm a little bit more enthusiastic about them. At least they've leveled off. But since it is so difficult to quantify what we're doing, I can't look and see, okay, we have a 90-minute physical activity law in Tennessee. I can't look at that law and see how it's really impacting our health or our numbers. So what we have started doing is collect success stories and bright spots across the state. And I am not kidding, every day I get bright spots sent to me from all over. On Wednesday I was handed a huge binder from a researcher at MTSU of 32 projects he's accomplished in early child care around obesity over the last 2 years. So it's happening all across the state, and even though we can't quantify everything we're doing, I know that we're making an impact on the health of Tennessee. I really feel strongly that we are.
Those are all great things, and we appreciate you being here talking about that today, especially because you have dedicated so much passion and time in your lives. So what do you think has really created this shift in perspective? We used to say it was really all about the individual. What do you think has really led most of us to understand it's the entire environment of health, not only for our communities but individuals as well? What do you think has caused that shift for most of us to say, this is not the ideal environment that most of us could be successful in?
I think because we realize that healthcare costs are impacting everything, and we have to have ways to turn them down. I mean, people that are involved in it that see reimbursement be cut down repetitively realize it's not coming from that. And when we talk about not having access to enough healthcare providers, it's because we have more and more sicker people. So I think it's the idea that we've got something that's just rolling out of control, and if you're going to put the brakes on it, you have to see some end in sight. We may not be able to fix everything, but if we can slow the progress down to where healthcare can become more affordable and more manageable, this is one of the best ways to do it, because obesity is responsible for a huge amount of disease state.
Do you see that awareness sort of shifting, that we all have individual responsibility, but it's also part of the entire community, and that leadership that's been mentioned a lot today, that they play a role in it as well. Are you seeing that? I know in your line of work, a lot of you already understood that, but do you see more just the general public understanding that concept a little bit better and willing to participate in the whole process?
I think the funders, you know, most of us live on soft money, and the funders are giving us money to do environmental changes, not program after program after program. So we've had to kind of shift how we prioritize and how we go about our business, because programs come and go and they don't necessarily sustain change. So we have to kind of go where the money is, and that's what they're funding because they believe that's what works.
So the programs are funding it, but I do believe that people are seeing it. I mean, once you really start talking about it, people won't stop talking about it. So, you know, the moment we announced that we had this public health grant about preventing obesity, I had phone calls from neighborhoods saying, well, when are you going to put a sidewalk in my neighborhood?
Yeah.
So part of it is, you know, in Nashville, I think the conversation's been going on a long time, and people are really connecting quality of life issues and access to safe places to be active. And, you know, I think Community Food Advocates really did a lot of communicating that people started to think of food deserts in a different way. And that's like when I've talked to people who live in food deserts, it's like, yeah, I want to be healthy.
Yeah.
I mean, it's like, it's not this strange concept from somewhere else. It sort of reflects people's reality once they think about it, and then they can't think about it any other way. To me, that's encouraging, because people then can go to various parts of their life, their workplace or their church or their kids' school, and say, you know, this could be different. Yeah. This could be healthier.
Yeah, and I'm going to step out a little bit on a limb here. I feel like I'm really playing into my preacher role, right? Ecclesiastes 3 says there's nothing new under the sun, right? So for a lot of the populations I work with, they've always known, right, that these things are interconnected, that the fact that it's not a coincidence that there's no healthcare services in the same place where there's no grocery store, in the same place that there's no, that schools are horrible, right? Like, that these are systemic, interconnected issues, and part of their lived reality. It's not a matter of whether or not they just had an epiphany that health is connected to all of those things. I think what we're seeing is a shift in the political will and public discourse around these issues, where people actually want to start engaging and talking about these. Because if I talk to a grandmother in Edge Hill, right, who's been living in the high-rise for 20 years, she could tell you about every single effort or every single temporary program or grant that's come through her community. But one of the other thing that I found to be most effective when you're talking about doing community work is sustainable change has to come from the communities that are there, right? And I think those communities know their issues, they have assets, and I think for folks in our line of work especially, we tend to go in with a little bit of a savior complex. Like, we're going to go into this community and save them. We're going to tell them exactly what they need to eat and how they need to eat. But there's knowledge already there. It may not be, you know, my hopefully very soon MDiv degree from Vanderbilt University, but it could be a degree from the School of Hard Knocks, just living and having to survive in a particular community, right? And so one of the things that we've been focusing on a lot over the past months at Community Food Advocates is how to capture that knowledge and also empower folks to fund their own projects. So shameless plug, we're starting a new program that we're calling Seed Money Suppers. So if anyone here is interested in anything food systems related, right? If you want to put a garden in your church, we're going to have micro grants available that will be funded by communities. Once a month, we're going to have suppers at different local restaurants with soup, and you'll get to go make a presentation before this big group of people, and at the end, by the time you walk out, you will have a check to actually go fund that project in your community. Our first one's going to be at Slowco in 12 South at 6 p.m. on the 28th. But that's the kind of capturing of knowledge and action taking that we're talking about. Well, I'm talking about.
That's wonderful.
The biggest impact I've seen in people changing of everything that's been done in my practice is insurance starting to base rates on health. because I've had people that just did not give a flip for how much they weighed or what happened, but when they were told that they would get a lower premium if they did the following things, all of a sudden, they actually started to talk about what they were eating, what they could cut back on, how many calories did they really need to get. So there is a certain degree, especially in the population that has more access to services, for personal responsibility and a monetary reward.
That speaks to people, doesn't it? Yes,
I think
ma'am.
that you can extrapolate that monetary reward into the systemic change, the systemic shift in what is seen as important, and even the willingness to see beyond just the individual, which also there's still an accountability, but beyond the individual into the systems, because that is where the solution lies. It does lie in shifting the way that a particular neighborhood has a lack of access to health care, to healthy food, and to good education. And I think that once it became, as it has become over decades, so incredibly costly for us as an entire nation, but even just Nashville as a city, to have such an obese, chronically ill population, once you start looking for solutions, you only have to scratch the surface to start hearing not only anecdotes, but also finding evidence of the fact that this is not just about individual choice, but embedded in so many of our social structures and institutions. And that comes from, like, money speaks, money drives things. And once that cost became so great, you had to look in particular places. And then to go even farther out on a limb, social movement theory tells us that there's a certain frame that frames the way that we have conversations as a community, as a nation, as a particular religious institution, et cetera. And as a nation, the frame that has most recently emerged is one of communitarianism, so one that focuses on the community. And so now it's obvious that, of course, when a new study comes out about obesity, there are going to be several sort of personal interest stories that come out as well in the news to highlight the way that particular individuals have become obese and are dealing with and grappling with their obesity. And so that opens people, those anecdotes don't make evidence, but they do make for compelling stories that show people the different ways that people's lives are lived and that they have become obese, or the struggles that they face in working to be healthy.
Let's take some questions from the audience, please. If you have any questions, go ahead and just raise your hand. We've got a mic that's going to come around.
Hi. I actually work in an indigent hospital, and a lot of my patients don't have access to internet or have phones. So I'm curious how you're advertising your services to a community that really lacks that type of communication.
Go ahead,
with the mobile market, we actually we have a website. Our website is primarily geared towards possible funders and supporters. We have a Facebook page similarly geared towards possible supporters, funders, and for educational purposes on the sort of more health professional or health student side of things. When it comes to engaging communities, we primarily ask the community how they communicate. And that, by and large, has looked like talking to community organizations and community services that are utilized already and making sure that people know about us there and can spread the word from there, as well as flyers, and again, just being there, being present. But flyers have really been our primary means of communication. And anything from having a flyer in the public library that Edgehill Apartment community uses to making sure that Brenda Morrow, the Family Resource Director at Organized Neighbors of Edgehill, constantly talks about mobile market and has flyers that are completely accurate as to our day, time, and location for that particular site. Because we've explored doing a text message alert system or something like that, but that costs money to the person who's receiving the text, and as you say, not everyone has a phone. Similarly with anything to do with the internet.
Flyers to all the local churches helps. It helps hugely because a lot of these patients have roots in the churches, and there are a lot of really big ones that play a large role in indigent communities. I trained in Memphis, and we had to use that. So if you get flyers out to the church, they'll make sure everybody knows.
Well, we employ a couple of strategies. One is like being physically present in areas where those populations are served. So I do community office hours partnering with different nonprofits and social service providers. So I'll be at St. Luke's, or I'll be at Community Care Fellowship in East Nashville. So those are spaces where I'm physically present. We've also done bus campaigns before, just to advertise on and on Metro Public Transportation, what our services are, when they're available, with our phone number and other contact information. So it's really trying to go to people where they're at.
Dr. Jenkins, do you think that requiring or promoting a lot of younger kids to count calories will contribute to more eating disorders?
No. I think eating disorders happen primarily when kids get into the teens and they don't like their bodies and they think they're overweight. If we could get kids to be aware of what it takes to maintain a normal body weight before they got overweight and decided they had to starve to death, or if they knew a better way to maintain their weight than to just throw up, it would be real helpful. Because if adults don't know this, these kids definitely don't know.
The anorexic ones too, that aren't even overweight to begin with.
Yeah, but even so, a lot of those kids start that because of bad self-esteem and not having enough information about what's going to happen to their bodies. If you are incorporating into nutrition classes early on, this is why you need to do this, you'll tend to put a barrier up for that. But a lot of the kids that I've seen who have had anorexia were chubby in middle school, got harassed, and started throwing up, taking laxatives, binge purge, to try and get their weight down so that they'd fit in. If they had a better understanding of, you know what, you could go dance to a Wii program or have a Zumba class at the school after hours or something, if you could burn it off a healthy way, they might be more inclined to do it.
Dr. Paul, you had a question, comment?
Yeah, I mean, when we were doing menu labeling, you're familiar with menu labeling, the idea that at fast food restaurants you'd see the calories right there? This question kind of came up, and I mean, it's a little bit of a mindset shift from kind of where we used to be, or maybe where we are now, that obesity is all about dieting and restricting. And what we're trying to do is change normal and basically prevent unhealthy weight gain, so that, you know, looking at calories becomes a little bit more like brushing your teeth.
Exactly.
An everyday, ordinary, commonplace event, and that it's not really about how people look and about restricting and losing. It's about really maintaining good health. And so it's like a piece of hygiene. We're a long ways from that right now. But right now we've got 2/3 of adults overweight and obese, and less than 1% of the population with eating disorders. It is something to keep in mind for those that are at risk, though.
So it's a more of awareness type. In other words, the more information you have, the better choices you can make is really the
Yeah, I mean,
perspective.
and I think that one of the ideas with menu labeling was that the market might change. People walk in and they see the sticker shock. People have no idea how many calories are in what they're buying at a fast food restaurant. And there are little quizzes online you can find. You know, what has more calories? 2 Egg McMuffins, 3 cheeseburgers, or a chocolate shake? The chocolate shake has, what, 1,800 calories in it.
There's one that has 3,000.
There's a shake that has 3,000 calories. And even knowing kind of what the target is for a normal adult, it's about 2,000 calories a day. And some of these things, you just buy one and it already sets you ahead for the entire day.
Yeah, I'm going to just jump in real quick on that question, because I think one of the challenges that all of us face is how to make health and defining health interact with our popular culture, right? In addition to why are kids getting picked on for not being skinny enough? Because the images of womanhood or manhood in the media tells you that you have to be a very particular size. So I think part of our job is our public relations message. How do we get images out there of what it actually looks like to be a healthy weight? And it's not with your ribs sticking out, right? And that's part of all of our jobs, right? That's how we engage with younger people. It's how the types of things that we promote in our personal conversation. So it's complex and it's complicated, but I do think each of us has a role in doing that.
First of all, thank you for making us aware of your organizations, your various organizations that you're working with. If some of you could comment on specific ways that you would envision Lipscomb University, and more specifically the College of Pharmacy and Health Sciences, as engaging with your organizations, either through service projects, research initiatives, or volunteer work? Maybe there's specific comments that you might be interested in making.
So the Nashville Mobile Market, we've worked to increasingly institutionalize the way that we do learning, the way that we function as a learning lab. And in the same way that I'm sort of community forward with the communities into which we go and open the market, I'm also very much sort of, what are your learning goals? What are the things that you need to do need to learn to do with a community population when it comes to working out ways of having volunteers, particularly if they're interested in learning a specific thing and on a particular program of study. So, for example, with the nursing students, they actually are placed in, they have a rotating site visit that they do each week at Parthenon Towers, which is a senior and disabled housing community that's right by Centennial Park. And it's a market stop, it's a market location. And so what we're gonna try to do is start to integrate in their home visits that they do with people, that they have a conversation about nutrition and maybe bring that patient from the home visit down to the market to talk about the nutritional value of what's on the market, to talk about ways to prepare different things on the market, and why a particular fruit or vegetable would be particularly good for their condition. In terms of pharmaceutical students on the market, I could imagine all sorts of different programming that could align from having an advertised day at a particular market stop that has a high volume of particularly elderly or disabled patients at a housing community that has such a population, where we say, bring your medications, let's talk. If you want to talk through and make sure that you're taking the right things at the right time, taking the right amount, and doing it with or without food intake, or maybe this one's making you feel ill. Well, let's talk about that and think about what you could eat beforehand and I may be totally sounding stupid right now because I know nothing of pharmacy. But those are the types of things that I could imagine. Or even having pharmacy students there to talk about nutrition, to rotate through and get to talk to customers and hear about the life that they lead, hear about where else they get their food, hear about maybe what pharmacy they use in town and how often they get there, or how they even get there. Just to know more about lives of patients in communities that are typically underserved, both with good nutritional food and with medical services. I'm flexible.
With the Obesity Task Force, we have, as I mentioned, 11 different action teams. You can go onto our website, Eat Well, Play More, Tennessee, join an action team if there's an area of interest. We have a faith-based sort of initiative going on. We have gardens, we have trails and greenways, vulnerable populations. We'd love you to engage with us. There's a role for you, and depending on what your area of interest is, in many different ways. We need folks that are really smart on media and social stuff. We don't have a huge budget for it, and I'm old. I don't know how to do that stuff, but I'd love to have people come on and give us some really great suggestions so that we can broaden our audience. One of the things that the Institutes of Medicine is really encouraging is to get into the messaging environment and see how it's impacting us both in a negative and a positive way, and how can we can't compete with the marketing dollars that industry has, but how can we be innovative about it? And so there really are a number of different ways to connect. And around policy, we set a policy agenda every year, and by golly, those legislators love to hear from students. They love to hear from a population such as yourselves. If you go down there and talk to them, and I talk to them, they listen to you. They are not going to listen to me. They're so engaged. And so anything you can do, and as a potential constituent of theirs also, so really there are a number of opportunities for you.
All of our volunteer opportunities are posted on Hands On Nashville, which is a great database of volunteer opportunities throughout the city. I would invite you to like us on Facebook, Community Food Advocates. Anytime we have an event coming up or a volunteer opportunity, it's also posted on our Facebook page. Or you can go to our website, www.communityfoodadvocates.org. I know right now we're looking for volunteers for our Seed Money Supper, which should be a really fun event. So if you have time and you're interested in just hanging out on the 28th, we'd love to have you there.
there are the health department does have some opportunities for internships. They're really usually couched within a contract between the organization and the health department. It's government, you know. We've got to be complicated about it. And honestly, I don't know off the top of my head whether we have specific training connections with Lipscomb.
We don't, but we're open.
Okay.
The
dietetic interns do, yeah. I mean, it's you know, we don't really have a whole staff to run an internship program, so it's when it's a win-win, it's a really great thing that we're able to do. But other things to think about as we're talking about policy systems and environment and a healthier community is that this is a community, and what, you know, think about what does it mean for Lipscomb to be conspicuously healthy? Not that everybody looks the same, not that everybody goes to boot camp and is a marathon triathlete or something, but how does Lipscomb make sure that healthy food is accessible and affordable, and people have an opportunity to be active, maybe stand up and stretch a little bit in a 2-hour meeting and that sort of thing. So I noticed a lot of that since I've worked here, or since I've been here today. I have come to meetings here and looked for the bike rack, and I can't find the bike rack. I live not too far away, and some of those ways of being conspicuously healthy. And also, as you think about going off into business, if any of you go into retail pharmacy, can a retail pharmacy think about a retail pharmacy? Is it an engine for health in the community? And what does that mean in terms of consciously, you know, running a business that's a healthy business? And sometimes that means making some decisions about what you offer and whether you're offering, you know, some of the pharmacies. I think it was in Chicago that Walgreens signed up to start at least having apples and oranges and stuff. And Walgreens is everywhere. But then probably every Walgreens has lots of cigarettes and other things like that. But those are some things just to ponder as you think about being in the health enterprise and thinking beyond the part of the health enterprise that you're in.
One of the things that H2U and HCA were working for in 2013 with Lipscomb is trying to create a partnership for opportunities. We have 37,000 people involved in our health coaching program. We have over 35 on-site clinics, so we include our PharmDs, our health coaches. So there's a lot of opportunities that are going to be coming, hopefully in 2013.
I forgot to mention one thing. A couple of websites. There is nashvitality.org. It's been a little quiet because our grant is over. We're going to try and figure out how to get it revved up again. And the mayor's office put together an app, Nash Vitality app, which is supposed to be your key to parts of Nashville that have opportunities to be healthy, whether they're you know, farmers markets or community gardens or greenways. And just get out and enjoy Nashville and be active in Nashville.
Those are great newsletters, by the way. I'll go ahead and send that out to the students along with all the others because there's so many. We posted some links to most of your websites, things like that, but there are always so many great programs, but we'll be sure to get all that information out to them as well. One last question? Yes.
Oh, let me get up.
We may have time for another, so if you want to be thinking about the final question here. So.
Lots of our students will be showing up on the Hill in the next couple of months at various and sundry Hill days, and several of you have mentioned the possibility of changing vending in the high schools. The kids who are in high school now experience the vending change in the middle school, so they expect for the vending to be the same in the high school, and I think some of them may be surprised to discover the soda and the chips in the vending machine when they get to the high school. What can we do? Are there groups that are going to be having that as a specific lobbying message this spring? I know we've talked about the effectiveness if the obesity task force goes on Hill Day and says the same thing as the dietitians when they go on Hill Day, and the hospital association when they go, and the pharmacy association. So if they're hearing that message over and over again, what does that message need to be, and how can we assist with that as we go to Hill Day this year?
So we'll be doing a brief. Maybe we can share the brief with y'all and you can put your identification and branding on it. So yeah, just contact me. That'd be great. We need all help we can get.
Do we have another question?
Kind of in wrapping this up, I was wondering how you see your efforts in our community hopefully changing national policy as far as regulating the food industry and related, I guess, policy changes.
Well, there's one story to tell. I mean, the food industry is a big issue that we haven't talked a ton about, and you know, there's drivers from the market demand side, and there's drivers from the supply side, and the Farm Bill is one that we haven't really touched on, where it's where corn is sold below what it costs to make it or to grow it. That's what they do with corn, is grow it. And so we have so much corn syrup, we've got to get it into you all. But our conversation on menu labeling occurred at a time when a lot of places around the country were doing this, and it was a really hard time for the industry to lobby all these state legislatures to get a lid on all the menu labeling regulation that was going on. So about the time that our conversation was winding up here in Tennessee, the folks talking about the health reform law, which is now the Affordable Care Act, decided the food industry and the health advocates agreed on language which is now in the Health Reform Act on menu labeling. And so at least for one little piece of that might have an influence on people's choices, eventually with full implementation of the Affordable Care Act, there will be menu labeling in fast food restaurants, and that may then shape what's offered in fast food restaurants when people get the sticker shock about it. But I've heard that McDonald's is already going to menu labeling, and you're starting to see market changes because of community pressure, community interest, stigma that's being put on products. Coca-Cola you can now get in a tiny can. I'm not sure that's a great thing, but it's better than the 24-ounce individual serving that people are getting. So there's some movement, but I don't know, Joan, if you have any other ideas.
SSB, sugar sweetened beverages also, we've been a big part of that conversation, and the more fires we can make them put out, the more distracted they are from some of the bigger venues like New York last year. We were asked to carry a sugar sweetened beverage bill to bring energy and focus here in the South, which it did, and actually the medical students at Vanderbilt have led it for several years. And it's gotten a lot of talking. It's helped in decrease consumption in the high schools and some other venues. But the more dispersed it can be nationally, the more fires they have to put out, as Dr. Paul mentioned. And that really did happen with menu labeling too. We were really a big focus here and helped to drive the national discussion. Around Transportation for America, we've allied with them to try and get more funding for programs like Safe Routes to School, things that aren't just infrastructures like bridges and roads, to fund things that make us have a more active transportation. So, and we have been part of these federal discussions.
Yeah, and I would say as a nonprofit community, we're constantly in conversation with our regional and national partners through organizations, for example, like the Food Research and Action Center, FRAC, who does a really good job of bringing those groups together, but also helping us set policy agendas based upon what we see happening on the ground. So that's one way in which being in conversation with people, attending conferences. We have a conference coming up, the Southern Sustainable Agriculture Working Group, right? Where a lot of nonprofits and government agencies will be together to talk about the real issues that we're seeing on the ground, and then try to influence policies like the Farm Bill and other things that have direct impact on these issues.
I think that something that I would hope for the Nashville mobile market, particularly as we continue to deepen our connections with other similar organizations across the nation, is for us to really hone in on the idea that making food available does make a difference. Because I know you may be aware that some studies have come out recently that show, or seem to show, that if there is healthy food available in an area, it doesn't have that much of an impact on obesity and on healthy eating. And something that we've worked to really shift, even in the way that we language things over the past 6 months, is to shift from just talking about food deserts, which just use that geographic marker, and to start talking more about food insecurity. That drives home the idea that it's not just about it being close, it's about it also being, there being a variety of food, the food being fresh, the food being affordable, and then that people's lives allow them, that their incomes allow them, that the education and willingness that they have around learning to cook healthy food or having learned to cook healthy food in the past, those have to also exist in confluence. And so that's why we do as much of the educational work that we do and work to be as communally relevant as we can to fill a niche and not just sort of impose our understanding of healthy food availability, so that we can show that making healthy food that is communally relevant and actually starts to solve some of the other food insecurity barriers to access does have an impact on what people consume in terms of healthy food and eventually on their health and their health outcomes.
All right, so one final last thought from each of our guests, if you don't mind. What's the one message you would like for our students to take away today?
I would just repeat, you all have a role, however big or large or small. We would love to have you be part of this because it impacts all of our lives.
Well said.
Bravo. Thank you so much for being here today. I know it's really warm and y'all have just been real troopers, and thank you to our students. We've heard a lot of terms today. Hold on just a second. We've heard success, networking, relationships, partnerships, and abundance, and faith. So I think it's ultimately about the connection that we have with each other. So thank you for being a part of our discussion today. We really value and appreciate your time and expertise. Thank you.